Do subscribe and don't forget to press the bell icon. Healthy Wrinkles, all about healthy living.
Very important that the patient caregiver, so whether the relative of the patient attender, or the guardian of the patient, has to be wary of hypoglycemia, particularly if the patient is elderly and they're taking insulin or they're taking sulfonylurea containing drugs. So we generally try to educate them. We have certain leaflets that have information about hypoglycemia with pictorial depictions, which talks about the different symptoms. So it's easy for them to correlate if they're able to see the images. And so that is one, to explain to them what are the symptoms. Secondly, we have to tell them about the corrective measures and checking the blood sugars. Now, what happens many a times in an elderly, suppose in case they fall unconscious, then it is not advisable for the caregiver to give anything orally, because what will happen if they're if they're unconscious, they might aspirate the, if it's a liquid particularly containing any glucose, and then that can lead to pneumonia or aspiration related side effects. But if they are conscious and they complain of any of the symptoms of hypoglycemia, then immediately after checking on the glucometer, even if they cannot check, if they feel the symptoms are matched with whatever has been explained in the clinic, then they can give them something orally. We also tell them that it is important for the caregiver to ensure that the elderly person has some carbohydrate with them in their pocket wherever they're going. Can be a candy. We generally tell them to avoid chocolates, because chocolates also have a fat content. So it will take a longer time for the blood sugars of that person to come to normal. Anything which is a direct sugar, ideally a liquid drink, so a small mango juice or any form of apple drink, that is much better if the patient has it with them. And we also tell them that it's important that the patient has a card stating that he or she is a diabetic, and stating that they might get hypoglycemia and they might fall unconscious. So just in case they've gone out, somewhere in the city, and just in case they've not eaten and they've exercised more, they've taken too much of insulin, if they fall unconscious, at least someone in that card would know that he's a diabetic, he has hypoglycemia, and they can take them to the nearby hospital so that immediate measures can be taken for that patient.